traumatic brain injury, or a TBI, can be caused by a bump, blow, or jolt to the head. The severity of a TBI can range from mild to deadly. A mild TBI may cause loss of consciousness, short-term amnesia, and mental status changes, whereas a severe TBI can cause physical disabilities, memory loss, and death. There are 1.7 million cases of traumatic brain injuries that occur every year, and 5.3 million people in the United States live with a disability that is caused by a TBI. Traumatic brain injuries account for around 2,685 deaths, 37,000 hospitalizations, and 435,000 emergency room visits every year in children under the age of 14 years old. In a moderate head injury, you can expect signs and symptoms such as headache, amnesia, confusion, and altered response to command and touch, whereas in a complex injury, you can expect to see blood and fluid escaping from the nose and ears, pupils becoming unequal in size, and blurred vision. When healthcare workers diagnose a traumatic brain injury, they first start with a systemic evaluation in the emergency room. Following their evaluation, they will then take their patient to CT to get a scan that can detect the presence of blood or fractures in the brain. The Glasgow Coma Scale is also used during a neurological assessment to assess for any mental status changes. After suffering from a TBI, your daily life is affected immensely. Your frontal lobe, which controls speech and problem solving, results in a lack of focus and irritability, and many people have a language deficit. Many people who suffer from a TBI will also have difficulty reading, blind spots and blurred vision, problems with short and long-term memory, difficulty walking, and changes in breath.
In terms of TBIs and health literacy, our group found a research article that explored the health literacy at discharge for caregivers of patients who have experienced TBIs. The study interviewed 23 caregivers of 22 persons hospitalized with a TBI about their knowledge and comprehension of what had happened to their loved ones, as well as the next steps in the recovery process. The study found the following results. All caregivers reported confusion about their family member's condition, care plan, or discharge plan. Caregivers were not able to define commonly used terms in discharge instructions and were confused by formatting and medical language. Caregivers were not aware of expected caregiving rules upon discharge. Thus, the conclusion was made that health literacy and therefore caregiver capacity to care for loved ones who have experienced a TBI is low after hospital discharge. The researchers then delve into what can be done on our part as nurses and healthcare providers to bring this literacy level back up. The following was recommended. Providers and teams should initiate formal, direct communication more frequently and utilize structured communication tools with patients and caregivers. We should not assume caregivers understand commonly used medical terminology. We should assess understanding and answer questions frequently, provide verbal and written explanations, provide patient-tailored written instructions, bold the important information, and finally, provide detailed descriptions of high-priority information. One research article highlights the specific areas of cognitive rehabilitation that must be focused on, as they are the ones primarily affected after every TBI. Impaired attention, decreased concentration, easy distractibility, impaired visual, spatial conceptualization, slow verbal and visual information processing, impaired memory, communication disorder, poor judgment, and poor executive function. Cognitive rehabilitation regarding these areas must be performed immediately, as literature and studies have reported that effective cognitive rehabilitation interventions initiated post-TBI enhance the recovery process and minimize the functional disabilities. Once started, the rehabilitation should be repeated and at regular intervals. The article states that the goal of cognitive rehabilitation following a TBI is to enhance the person's ability to process and interpret information and to improve the person's ability to perform mental functions overall. In order to accomplish this goal, researchers have summarized the two overarching approaches of rehabilitation. First, the restorative approach aims at reinforcing, strengthening, or restoring the impaired skills. The second approach, the compensatory approach, teaches ways of bypassing or compensating for the impaired functions. For attention deficits, specific skill training focusing on visual and auditory attention is recommended. For memory deficits, wordless listening to paragraphs read out loud, visual imagery, mnemonic strategies, and memory notebooks are recommended. For language and communication deficits, studies have reported that pragmatic language skills, social behaviors, and cognitive training, along with psychotherapy for emotional adjustment, can significantly improve the social communication skills of those recovering from a TBI. Lastly, for executive function, structured and repetitive cueing, encouraging repeated assessments and self-monitoring, and breaking down complex tasks into smaller steps and directly teaching individuals step by step is recommended. This research study was essential when it came to creating our teaching goal, as it gave insight into what areas of cognitive impairment are the most affected by a TBI and how we are able to restore them or compensate for them with a variety of different strategies and training.
So I researched what to expect after a traumatic brain injury, and some of the cognitive and physical impairments include impaired attention, decreased concentration, easy distractibility, impaired visual spatial conceptualization, slow verbal and visual information processing, impaired memory, communication disorder, poor judgment, and poor executive function. Attention and concentration, they are building blocks of higher skills like memory and reasoning. If you have a deficiency in one of these areas, it can affect many others. Impulsive behavior may occur because of decreased ability to control situations. Physically, however, an individual may suffer from dysarthria, which is slow or slurred speech, dysphagia, which is difficulty swallowing, and apraxia, which is coordination of speech muscles. It may take weeks when determining whether the injury is short or long term, and this is because swelling or bruising or contusions are only temporary and may take a while to subside. Children have a higher chance at recovery than adults because their brains are more flexible and are still developing. Swelling occurs in the brainstem, which is responsible for consciousness and wakefulness, and this could develop into a coma. After a TBI injury, a patient may want to rush back to life as they have left it. However, it is important to work on basic skills before complex skills are added. Last thing is that assistance will be needed. A speech therapist or psychologist may be useful for assisting with reasoning and problem solving. This is most successful when tailored to the client's interests, so that is what to expect after a TBI.
Cognitive impairment that occurs from a traumatic brain injury isn't always specific to one problem, and it can look different for every patient. From the article titled Cognitive Impairments After Traumatic Brain Injury, it states that cognitive impairments include problems with attention, concentration, speech and language, learning and memory, reasoning, planning, and problem solving. Depending on the traumatic brain injury that occurs and the severity of it, it will affect people in different ways, and people can experience one or multiple of these cognitive impairments. From the study conducted by Barman, Chatterjee, and Bide, it states that the goal of cognitive rehabilitation is to enhance the person's ability to process and interpret information, and to improve the person's ability to perform mental functions. Since the mental function capabilities will look different for every patient, there are a lot of different things that can be done to manage the cognitive function of a patient. Restorative is to restore the function of the brain that was impaired. It includes the repeated exercise of standardized cognitive tests of increasing difficulty, targeting specific cognitive domains. Compensatory is learning how to function with a new cognitive impairment. With this approach, you will use different strategies or devices to help the patient with daily activities of living, like calendars, electronic memory devices, alarms, or reminders. But overall, with the management of cognitive impairments, it is vital that everyone involved in the care of the patient remains patient. It will take time and effort for the patient to improve or to adapt to the new impairment, and it can get frustrating at times. Work on being patient with the process and focus on encouragement. Patient needs to feel supported during all times of this process.
The teaching care plan for managing a traumatic brain injury includes steps related to managing cognitive impairment. However, before teaching the patient and the people that will be caring for them after their discharge, it is important to take into account the patient's health literacy as well as their cultural beliefs. Health literacy is the ability to understand health-related information. It is suggested by the American Association of Neuroscience Nurses that a patient with a TBI is taught at the 6th grade reading level. It is also important while teaching a patient who has suffered from a TBI to consider the neurological deficits that may be present. It helps to ensure the understanding of the education you provided. As stated before, culture is also important to take into account while teaching a patient, as it may indicate what life will be like after discharge and what the patient's beliefs are relating to their care. The following is the information that should be included in a typical teaching care plan for a patient who has suffered from a TBI. The nurse will need to inform the patient that during recovery it is important that they rest during the day and sleep a good amount during the night. Avoid activities that require a lot of concentration and physically demanding activities for at least 2 to 3 days after their TBI. Avoid recreational sports and contact activities. A nurse should also tell the patient to gradually return to work. Alcohol and caffeine may also worsen symptoms, so it is important to avoid these. It is important that the patient create daily routines and complete one task at a time. The patient should limit noise and avoid the use of electronics over a long period of time without interruption. The nurse should also communicate a time frame for full expected recovery to the patient. The nurse should tell the patient and their caregiver that home monitoring and observation is needed to be done for the first 24 hours. It's extremely important that the nurse tells the patient that if any of the following symptoms occur, they should immediately return to the hospital's emergency department. These symptoms include repeated vomiting, seizures, confusion or sleepiness, paralysis, a headache that has gotten worse, and not being able to remember new events. If the patient is prescribed any medication to treat the symptoms following a TBI, the nurse needs to educate the patients on these. Final thing that a nurse needs to educate the patient on is how they can prevent a TBI reoccurrence. It is essential that after education is provided that the nurse evaluates the learning of the patient. Finally, the nurse needs to document.
There are many factors that need to be considered when teaching a patient. These include age, culture, language, environment, current situations in relation to pain or medications, timing, resources, and evidence-based practice. The patient's age determines the type of education that needs to be given, or if a parent or caregiver needs to be nearby. Role comes mainly from who someone has in their life to support them. This is, for example, like a spouse, parent, or sibling. Especially in a patient experiencing a TBI, help from someone may be needed to carry out everyday activities. An optimal environment is a quiet room with minimal interruptions to ensure patient confidentiality. Timing is usually based on how the patient is feeling. Availability of resources includes things like transportation and healthcare insurance. If these resources are not available, it is up to the nurse to advocate for their patient by helping them attain the support needed. Lastly, evidence-based practice is extremely important when giving patient education. In order for the nurse to give correct information to their patient, they need to understand why it's being given and how it helps. When helping the patient manage their cognitive impairment, it is important to express the importance of patience. Make it known that they will not feel their best self for a while and they may need to slow down from their everyday life. They also may need help from others. Make sure that the patient is aware of their medication regimen and why each medication is being given. The patient will be more willing to follow it if they know how it will help them. The main cultural difference that should be considered is the language that the patient speaks and understands. If the language is different from the nurse, then a translator, photos, drawings, or videos should be given in their language. Another difference would be the way our patient's culture perceives their illness and treatment beliefs. In order to make this topic easy to understand, it is important that the nurse finds out what type of learner the patient is. There are 3 domains of learning: cognitive, psychomotor, and affective learning. The cognitive domain includes memorization because the patient is able to recall the information that was first taught to them. The psychomotor domain incorporates physical movement into the learning. Allowing the patient to perform the task themselves will help them visualize the skill when they go to do it. For TBI patients, if they are able to, allowing them to perform activities of daily living may be beneficial. This also allows the nurse an opportunity to see if the patient has gained any knowledge from the education. The affective domain correlates with the patient's attributes of feelings, values, motivation, and attitudes. Resources such as written step-by-step instructions, a pamphlet of information, or a packet of pictures for them to visualize the teachings could also help the patient. It may also be smart for the nurse to create a checklist for themselves. This helps the nurse make sure that they get everything done that they need to teach the patient.
So for our teaching tool, we decided to make a brochure on managing cognitive impairment after a traumatic brain injury. In the first flap, it's basically just explaining what a traumatic brain injury is and different statistics in the United States, and it's actually more common and treatable than they may think. On the inside, it's mainly talking about recovery, that there are different things that you should expect, and your recovery and the length of your recovery will depend on your age, pre-existing conditions, and the severity of your brain injury. It explains different approaches for rehabilitation, such as little things you can do at home, and then also some clinical approaches. It explains what to do following your traumatic brain injury, such as if you see these symptoms, go to the emergency department, and different post-concussion symptoms and how to relieve them, such as physical symptoms, cognitive symptoms, and emotional symptoms, and then also how to prevent traumatic brain injury reoccurrence. And on the back, it's just little things that are important that you do during your traumatic brain injury recovery, such as rest, avoid activity, avoid sports, create daily routines, and focus on completing one task at a time.